Hello everyone, and welcome to Foundations with the Fellows. Today I'll be going over BLT of the sternum. So remembering the anatomy of the sternum, the fibrous pericardium of the heart is going to attach to the inferior part of the sternum by the sternopericardial ligaments and then to the central tendon of the diaphragm underneath. So keep that in mind as you're doing BLT. And remember, for BLT, you are bringing an articulation or a joint or tissues to a point of balance and holding while the tissues unwind until you feel the release or the breath return back into the tissues. So for the sternum, we're going to put our bottom hand on the upper T-spine and top hand completely over the sternum. And if you wanted to move the sternum into flexion, you're going to make this type of a motion. That would be flexion of the sternum. This would be extension of the sternum. For side bending of the sternum, your hands will kind of move together. And then rotation is a little harder, but just think about that rotational component of the sternum. So start by putting your hands, thank you Phil, under the T-spine, and then put your hand firmly over the sternum. If you have a woman, you can use just simply 2 fingers or just the side of your hand. And first you're going to let your hand sink in so you get to the sternum, thinking about the anatomy of the full sternum and all of its attachments. So you're not up here superficial. It's not a myofascial release. It's a BLT of the whole sternum. And we can test flexion and extension. So Phil definitely likes to flex. We can test some side bending. And he likes to side bend to the left and a rotational component to the right. So you can go at this point indirect or direct. I'm going to go indirect, so I'm going to exaggerate the motions that Phil likes, thinking about the whole anatomy in my hands. And I'm not following it, I'm holding it in a point of balance until I feel the tissue slowly unwind. And then always, when you're done, reassess. Is that good?